to recite. I was going to ask everyone to recite the Statue of Liberty, the Pledge of Allegiance, but since everybody is muted, we'll pass that up until the next time. So let us have a moment of silence for our deceased members. Let's also remember the 13 servicemen killed in Afghanistan, the people in Haiti, and the people in New Orleans. So our deceased members are Adrian Collins, Dwayne Francis, Helena Kirkpatrick, and Fred Walters. So if you just have a moment of silence for them. Thank you very much. So moving on, Donette is not going to be with us this afternoon, Gemma. She called and said that she had a doctor's appointment at 2 o'clock, so she's not going to be on. So then we can just move forward to updates from Aaron.
Okay, thank you, Gloria. Thank you for those acknowledgements. Hi, everybody. Welcome back to membership meeting. Happy fall. The summer is coming to a close. It always feels like a new year has started in the fall, which it can be inspiring and hopefully bring in new and better things to us. So I have lots of things to talk about and to update you on. So I'll try to move through them swiftly, not take up too much time, but hopefully, I can answer some questions you probably all have. Thank you for those who have continued to participate and join us in these meetings on Zoom and in person, however you feel sort of comfortable at this sort of crazy and uncertain moment. And it is a bit of an uncertain moment as we sort of jumped one hurdle in this ongoing pandemic and here are in a new sort of phase of it. So I want to address that a bit and talk about what that means for the center and highlight sort of some of the things that are happening. It has been, we have, only grown over the course of the last year and a half in terms of the services that we're able to provide and our network of participant members like you all. That has grown significantly, which is a good thing, and I think speaks to the resiliency of our community and how welcoming all of you have been and are. Okay, so why don't I start with where we're at in terms of the center itself. So we are open for business. So make no mistake, we are open, we are there. There is programming happening indoors Monday through Thursday at this point. So there, if you see people in the dining room there, those are folks that are on site and in the space. There is now walk-in clinic for the social work team Monday through Thursday. So if you need to see a social worker and don't want to wait for an appointment, you can come and do our walk-in clinic. We have our nursing. Our nurse, Lachelle, is on site on Tuesdays and remote on Thursdays. So you can also walk in to see a nurse, talk to the nurse. There's blood pressure clinic happening, get your blood pressure taken. There is health coaching with Indira. Those of you who know Indira, that's on site now. And there's exercise program, there's group programming, and things like this are hybrid. So we're on Zoom and we're also streaming live in the dining room. So everyone in the dining room, let's wave. Hi, everyone. Good to see you all. Thanks for joining us in person there. So, and the virtual program continues. So Gemma has been very, very diligent in keeping a robust digital virtual program on Zoom. And that's because we understand if you don't feel comfortable participating in person, and everyone has a different level of comfort about that. So we understand, we just want you to be engaged and feel like you can stay engaged and stay connected, however you do that, whether it's by phone, virtual, in person. Meals are now both grab and go and congregate. So you can come and get a meal Monday through Thursday, double meal on Thursday for the weekend at 11:30. You can pick that up and take it with you, or you can sit down in the dining room and set up a nice sort of setup so that you can sit with a clear barrier between you and the person that you might be sitting kitty corner to or across from for that extra protection. I have to reiterate, you must still pass or go through the health screening when you enter. You have to answer those questions. If you're not feeling well, please stay home. Please don't come in if you're not feeling well, if you have cold symptoms or any of the symptoms associated with COVID. And you have to wear a mask indoors. Unless you are actively eating and sitting at the table, you have to have that mask on. And I had to call somebody a couple of times now to talk to people about that, because some folks say,
sorry, I accidentally muted you. Sorry about
okay.
that.
So just to reiterate, you have to, that's for everyone's protection, that you still wear a mask. Remember, you can still get COVID-19 if you're vaccinated. It's much less serious and severe in cases, but you can still get it and carry it. So wearing a mask is important indoors. This is a senior center, or a center where older adults are. Older adults are more at risk for health problems with this thing. So please be diligent about that and keep your mask on when you're at the center. It's something we all have to work on together. I want to talk about vaccine mandates. So there's been some questions and good questions about what's happening at Isaac Center regarding vaccines. So right now we are following the city guidelines. The city of New York is mandating that all of our staff, our consultants, and our volunteers, so anybody that's providing a service on site, must be vaccinated or submit a weekly negative PCR test. PCR tests are the more accurate version of the COVID testing. So if you are somebody that volunteers handing out meals or runs a program, or is active in the dining room, you'll be asked to either share proof of vaccine, or you'll have to submit a weekly test in order to participate. All of the staff are under those guidelines too, and we're monitoring that very, very carefully to be in compliance to make sure that we're safe. Right now, participants of the center and the centers across the city do not need to be vaccinated or show proof of vaccine to participate. So if you're a participant in the program at this point, does not have to do that. We will follow and make adjustments as the city guides us and as our city and state guides us, but that's where it's at right now. So if you've been asked by Gemma or by Alberto to submit a proof of vaccine or a test, it's because you are considered a volunteer. You might be a participant and a volunteer. So those are, we can take questions about that. And I understand that some folks have expressed, understandably, that they're not comfortable knowing that there are people at the center that might not be vaccinated. What we can say at this point is that we understand that. It's a choice that everyone's sort of having to make. And we want to make sure that if that's where you're at, that you still feel connected and still feel like you can participate, whether that's virtually, with grab and go, with outdoor stuff that we're only able to do when it's not really hot out. So everybody can sort of make a choice, but still be connected to our community and our programs. That's very, very important to us. And if you have ideas, or if you're feeling like you're finding it hard to participate and feel engaged, please let us know that. Talk to me, talk to Gemma. We will do whatever we can to make everybody feel safe and comfortable. Okay, so there's been a lot of changes and things I want to sort of talk about in terms of staff. So as we announced at the last meeting, and Greg is out on his first vacation, I think, in 2 years. So I'll cover this time. But last time we met, we talked about our Isaac Center's strategic alliance and engagement with Goddard Riverside Center. We have merged a lot of our functioning with Goddard. That doesn't change. Isaac Center is still its own program and its own center, but there are some changes associated with that. One of them is my role. As we shared last time, I'll be taking on a larger role within that network. So while I'll still be supervising Gemma and Alberto and Gloria, I'll also be taking on some new oversight and administrative stuff with the other programs. So you'll see, I'll still be on site, you'll still see me, but my role will shift a little bit. And some of those duties will be sort of in different departments or different managers. So I just want to sort of reiterate that, and we can take questions about this as well. So who do you talk to at this point? So Gemma, our program manager, her role was elevated to program manager last, I guess, about a month and a half ago now. And she's been doing a great job. She more than has earned that over the last year and a half or 2 years now. So Gemma is your go-to about program stuff. If you have questions about the program, she can be your resource. Alberto Rivera is our manager for community engagement. So he is specifically overseeing the food pantry program through New York Pantry and through Food Bank of New York. So this is that's exciting. That a lot of that is new programming. So we have if you need access to Food Pantry, talk to Alberto. And maybe Gemma, if you can put some phone numbers and emails in the chat, that might be helpful for these folks. Gloria is still our clinical manager. She's overseeing the social workers. So if you have questions about the social worker, she is in the dining room. So if you have questions about social work related items, if you need to talk to a social worker and need help with your benefits, need some help, some counseling or connections with medical stuff, anything at all that you're worried about, need social work support for, Gloria's supervising that team, Albert, Karina, and Michelle, and is welcoming 3 new students next week too. So exciting there. Crystal is our director of food and nutrition. So Crystal is overseeing still the Meals on Wheels program as well as the kitchen. So she's still seeing all the great meals that are being produced. Henry is our food director, his title, but Henry is overseeing the kitchen with Crystal as well, so can be a resource for you. So those are just some of them. I know I haven't covered everybody, but I just wanted to clarify that. And then, we have, to sort of expand on that, the food program has now been Senior Director of Food and Nutrition. Thanks, Crystal. So we have more food options, meal options than ever. We are doing grab and go meals, as you know, congregate meals, meaning sit down in the dining room meals. We have food pantry available for anyone at this point. There's not a waiting list for that. You can sign up with Alberto if you're interested in getting food, shelf-stable food items delivered. Soups Up, we have Corey on today who's going to share details of what's going on with Soups Up and the next iteration of that wonderful program. And Meals on Wheels, if you're eligible, if you are homebound, meaning you're not really able to leave the house without assistance, you may be eligible for Meals on Wheels. So please talk to us if any of those things are of interest to you. Gemma will talk more about specific program, but I do want to just sort of shout out that we're going to, that things should be boosting in terms of programs. We're talking about reinstituting trips. We are posting for a position for a driver for the bus to get that back up and running. And we're looking to do a paper calendar to bring back the SyncLink for you this fall. So we both have a paper program and the daily emails. A lot of exciting stuff happening. I think I'll pause there. As usual, I'm sort of going on and on here, but a lot of stuff to tell you about. I hope that this all sounds good. If you do have questions, I'll be here to take questions after we do the update. So thanks everyone for listening and enjoy the rest of the program.
Thank you, Aaron.
Gemma?
Hi, everyone. Sorry. So I have lots of updates on programming. So as Aaron had already mentioned, we are still working as a hybrid model because we want to make sure that whether it be that you can't make it to the center, you're not necessarily comfortable yet with coming back to the center and participating in person, we want to be able to have options for you to be able to still join us. And so we still have a lot of the Zoom programs that we were running during the pandemic, and still happening. But we still have a lot of the programs that we started when we started our virtual programming. The attendance for that programming has decreased. We understand that a lot of people are really excited and eager to be able to join classes in person. And we want to keep those virtual programs running. So if you have any interest, please join, even if you don't necessarily feel like you're going to participate, but you want to check it out and see what the class is like, definitely join. We did end up having to cancel our yoga class. It was a gentle yoga class. But we have that instructor and she's teaching a chair yoga class in person on Wednesdays at 10 a.m. And we're looking at adding a meditation class with her as well. The Move and Make Merry class that's on Fridays has also had incredibly low attendance. And we love that class is fantastic. It's a dance class, but it's very intentional in terms of balance and strength training. So if those are things that sound like they're interesting to you, definitely give the class a try. Even if you feel like just observing, just to see if it's within your comfort level. Indoor programming has been going really well. We're happy to see familiar faces, new faces in the center. And everyone's been doing a really good job of making sure wearing masks and everyone is making sure that everyone else is comfortable around each other. And yeah, so just some updates in terms of classes and programs that we're adding. So some ones that are coming up that I think are going to be exciting to people. Yvonne's daughter, Marina, will be doing a Young at Heart dance class. It'll be Mondays at 3 p.m. starting September 13th. And then Yvonne will be teaching a Young at Heart dance class, and that will be Wednesdays at 3 p.m. This will affect the schedule that exists now. And I'll make sure to email updates as they come, but I know usually there's pool hours at that time on one of those days. So we'll make sure that there's still gonna be hours for people to join and be able to utilize the pool table. I gotta work out the schedules. We have the food bank for New York coming back to do food demos with us this month as well. We're going to try to make that a monthly occurrence. These food demos are fantastic. On top of just showing you how to make recipes, you learn tips on how to store fresh produce, how to stretch your food dollar, and how to make healthy recipes and how to kind of shop seasonally. So we're gonna start the Spanish. It's gonna be the same demos, just in Spanish. The first one that we'll have in Spanish will be the 22nd of September, and that will be at 1 p.m. And it'll be hybrid. So people who may not be comfortable coming into the center but want to attend, there will be a Zoom link that will be shared. We also will have the food demo that next day, actually in English at 10 a.m. And then we will have on the 23rd, some of you may have met the team, but the Do More Feel Better team from Cornell, they work with people who have been diagnosed with depression. The workshop, I think, is gonna be fantastic. It's gonna be an opportunity to kind of learn about depression, tips on how to like coping mechanisms, healthy coping mechanisms. And you may be able to learn more about their program and see if you qualify for that. And that will be at 1 p.m. 1 p.m. in the dining room. And then we will be, sorry, we will be starting the book club up again. I know right before the pandemic, Rhonda Taylor had kind of started to kick that off. And I think that it would be really nice to be bringing that back. We're gonna do those meetings monthly. They're gonna be on Zoom, but they're gonna be hybrid if there's enough interest to screen the meeting in person. And yeah, so the first meeting will be October 4th. It'll be the first Monday of every month. The first meeting will just be going over and trying to decide maybe some books that you may be interested in adding to the list, and this will give people time to get the book, check it out from the library or whatever you may need. We do have Kindles, the Amazon Fire tablets or Kindles or something that we're able to lend out to people if they're not able to access the book on their own. But we have a limited supply of those. So And then we also have another food bank demo. This is kind of jumping the gun a little bit, but I'll make sure to repeat it in the next meeting. October 20th, at 1 p.m. There will be a Spanish food demo again, and then the 28th of October will be a food demo in English. So those are some fun things to look forward to. I also have a Stretching Your Food Dollar workshop tomorrow at 10 a.m. It'll be hybrid. It'll be in the dining room and also streamed. Unfortunately, I don't have a cooking demo to share, but I'll be going over really helpful tips on how to save money, store foods, and make sure you're getting more bang for your buck. And then next Thursday is Social Action Committee. I think those are all my updates. It's a lot. But yeah, if you're not already on my email list, or you have friends that you know are members that have email addresses but may not be getting my emails, please send them my way. I think one of the most efficient ways for me to get information out to everyone is via email. I try not to spam you guys with robocalls, but we, just in terms of capacity, we can't always make individual calls or do huge mailings. We always have all the flyers I attach to emails in the lobby. And all this information about programming is always in the lobby, printed out on flyers, but the best way to get information about programming is via email. And you can always call the center, call the front desk. They get our daily emails, so they're updated on the programming. And this way you'll be able to keep up with what's happening.
Okay. That's it? You're done? Okay, is Crystal here? Is Crystal coming on today? Crystal Simmons?
Crystal is here. Crystal is present.
Good afternoon.
Good afternoon. So Aaron already introduced me, but for those who do not know, my name is Crystal Simmons. I am the Senior Director of Food and Nutrition Services. So I just got a title change in the beginning of July that everyone's still getting used to, and I'm still getting used to. So I oversee the kitchen team, which is Jeffrey and his team, as well as the Meals on Wheels team, which everyone remembers Alicia. So we all know about the Meals on Wheels program. Everyone knows about Grab and Go. So I'm not going to go too much into the specifics of Meals on Wheels, but of course, if you know anybody who's interested in Meals on Wheels, whether it's temporary, you're going to have surgery and you need meals to be delivered to your home temporarily, then of course you reach out to me, or you can reach out to a member of my team. That's not a problem. But in addition to that, we have a nutritionist that has joined us. The nutritionist is on site Mondays and Wednesdays at 10:30. So if you have questions, if you'd like to sit down and have a conversation with our nutritionist, please come in. We're going to create a flyer sometime next week, but as for now, she's just been building a rapport with the seniors that are coming into the building. She's been assisting with Grab and Go, and then soon she'll start to do some classes and have some one-on-one sessions. We're going to be more focused on people who have hypertension. So please come and join us. I'd love your feedback. In addition to that, I'm hoping to start our, it's not going to be called food committee meetings, but I'm hoping to start connecting with some of our senior center clients. I'd love your help on working with our Meals on Wheels clients. And that's just by making phone calls and contacting our Meals on Wheels clients to see, what they think about the food. I think when it's peer-to-peer, the information comes, it's more forthcoming than me calling, because I don't think that everyone's going to tell me the truth about the food if they hear that it's the senior director calling. But if they hear that it's a member of the senior center who's actually eating the meals, then perhaps the information will be forthcoming. But please, when we have surveys at the center regarding the food, it is crucial that people please respond to the surveys. We have our own survey going, so I've been having lunch at the center every day and giving my feedback on the meals. So my palate might be completely different to someone else. So please, when I receive only 5 surveys and I know we fed 100 people that day, it's alarming. So fill it out, the surveys, it's in English, Spanish, Mandarin. If you'd like it in another language, French, Russian, let me know. I will translate it as best as possible. Again, I'm here. I know Aaron touched on Henry Foster, who joined us in May. He's the Director of Food Service and Delivery. He's been doing an excellent job. So if you are on site, please see him, stop by, say hello. He's very great. He comes from the world of food. So if you have questions, please see Henry, see myself. And soon we'll go over the menu again in the next couple of months. So your feedback, I know we did this way back when early last year we had went through the menu and we took out what was good and what wasn't good. So we'll be doing that again. And I'm hoping to see everyone again soon. You know where I'm at. I'm always here, except on Fridays. I am not in on Fridays. But other than that, I'm on site. I would love to see some faces, some friendly faces. Email me, call me. You know how to reach me. Thank you.
Okay, thank you. Thank you. But Henry's not there today.
So Henry is moving around a lot today. So we're just doing some final touches, but he will definitely be present at the next menu, at the next meeting. See, I'm always thinking food menu. Present at the next meeting.
Okay. All right, Crystal, thanks a lot. It's good seeing you.
Great seeing you too.
Okay, Corey Bordeaux, are you available?
Yes, I am.
Okay, you're up.
Sounds good. I'm going to talk about the Soups Up program and some of the things that are changing in Soups Up. For those of you who don't know, Soups Up is a program where we make hybrid meal kits. That means that some of our kits our kits have a combination of cooked food and raw food. So some of them are going to have fresh fruits and vegetables along with a freshly cooked quart of soup. Those get distributed on Fridays. For right now, we also have a box that we call a vegetable pack that is exclusively fresh fruits and vegetables. That's what we're delivering on Fridays right now. The Soups Up team is looking for a replacement for myself. I'm being moved up to the Director of Culinary position. So for right now, Soups Up is not going to be offering soup. It's going to be in October before our soup comes back. So I wanted to let everyone know that, number one, the soup is coming. And number two, if you're interested in getting fresh fruits, fresh vegetables every Friday, we make sure that we get the freshest stuff we can, the best quality stuff we can. Then reach out, speak with Gemma, and we'll see if we can find some space on the list and send more boxes out. We'd love to send more boxes out.
Okay. Okay, that's it, Corey?
Yeah, Soups Up is really straightforward. We love to give away fruits and vegetables.
Well,
That's what it's all about.
I myself get the produce box on Friday, and I would have to say that it's really a godsend. I appreciate everything. The vegetables are great, and I was really surprised about 2 weeks ago when I actually got a nice slice of papaya, and which was excellent. So thumbs up for the produce box. Okay, I can speak to that. All right. Some of the members have said, Corey, that it's a little difficult with some of the directions on how to prepare the soups with what they get in the box. Okay, so I don't know if somebody needs to go over it or review it again to see how it's written, but those were some of the complaints that I got about the soup. Okay, but other than that, it's been welcomed also for the seniors that I speak to that have been getting it. So that also is a thumbs up for that coming October.
I appreciate that. Thank you very much for the feedback.
Okay. All right. Thanks for coming. Next up, we have, what's the name? Kathy?
I sure am here, Ms. Gloria. Good afternoon, everybody. I hope you're all doing great today. So my name is Kathy Robles. I am the Assistant Director of our Education and Workforce Program and currently our Acting Director. So I basically help manage our young adult programs here at 1792, which is right across the way from where the center is. Really want to come back and let you guys know that we are getting ready to have young adults back in the building.
Okay.
Our programming is starting next week, which means our participants are going to start coming in next week, Wednesday. And we should expect to only see between 25 to 30 participants per day per staff members. So if you see them, say hi. We are going to still be following social distancing. So as of right now, they are not going to be meeting you guys in the dining room like we had about a year and a half ago. They are going to be eating their lunch from our classrooms to make sure that everybody is nicely socially distancing and we're not crossing anything in between. So as far as other programs that are going to be happening, we do have a culinary program. Although they are not here with us within our community, they are working within the Asphalt Green Kitchen that we have a partnership with. You never know, these participants might be coming in to do demos with you guys. If I'm not mistaken, the homecoming that we have coming up might actually include some of our participants. Corey, you can correct me if I'm wrong on that. So good things to come. Again, we're very, very excited to have programming back on site. So you're also going to see some interns that are going to be in the building that are going to be partnering with either Gemma or Alberto to be able to deliver food or host programming. I know that a big topic of conversation has also been the tech assistants. We had a really great turnout with our summer youth interns, and we are bringing that back again come the fall. So you should expect to see some additional help with that, and I'll coordinate with Gemma what that's going to look like in reference to scheduling within the next 2 to 3 weeks.
Thanks a lot, Kathy. That's a lot. I
I
tried
know.
to sign on for the homecoming, and I don't know. How do you do that? I tried to.
I am not sure, Miss Gloria, but I can definitely find out for you, and then you can relay the information.
Okay, thanks a lot. Thanks for
No problem.
great
Of
stuff.
course.
Okay. All right, who else do we have here? Is that it? I think we've reached everybody.
Pocky.
Go Potki, right? Is she here? Potki?
Hi.
Hi.
I'll be quick. It's wonderful to see everybody. Obviously, there's a lot going on. I know that we have, we've had some inclement weather and obviously the devastation in the South. And so to get everyone together, on calls like these is immensely special. And I just want to say I'm grateful to see everybody. Greg also has his love and we'll be back next week. I wanted to just very quickly touch on one quick subject, which is our senior center bathrooms. We have had many, many, many conversations about the need for their repair. And thanks to the support of the Manhattan Borough President's Office, we are finally going to get that project underway. We are having our initial conversations about site safety and how we keep people safe during construction. And so there will be more details to provide soon, but we are hoping for a kickoff next month in October, whether it's the mid or end of October, we are not necessarily sure just yet, but we will provide those details as soon as we can get them. And if folks have questions, concerns, etc., before then, I want to echo some of the sentiments that Aaron provided in the beginning of this meeting about our adherence and strict policies around following CDC and Department of Health guidelines and federal guidelines around both masking, social distancing, sanitizing, temperature checks, and all of the other good stuff we're trying to do to keep everyone safe. If folks do have questions, concerns, etc., please know that we are here at any time to address those concerns. Me, Greg, Aaron, Crystal, all of us. So please don't keep worries and concerns to yourself. Call us, email us, come talk to us at the center. We want to make sure that we're addressing everybody's concerns as we move forward. Thank you to everyone. Thank you, Gloria King.
Thanks. I saw you Wednesday. I don't know if you recognize me.
I could never not recognize you. It was wonderful to see you.
Okay, good seeing you too, Potkin. Thanks for the update.
Thank you.
Moving right along. Aaron, do you have anything else that you wanted to add? Any questions for Aaron? Any questions for Gemma?
One thing that I did miss in my notes here when I was talking about food is just to note that for those of you who are still receiving the Get Food program, that's the city-run program that delivers meals, that's been delivering meals since early on in the pandemic. That is coming to an end. So that program is ending on, we've been told the last referral day will be the 1st of October. So 1 month from today, the last delivery will be on October 15th. So we're going to start outreach to everybody that we know of that's been receiving that. And we've been helping do the referrals for over 300 people. So we will call all those folks. But I do want to say here that if that's you, if you're still using that program and are sort of relying on that program or like that program, talk to us, because we're going to have to figure out the best alternative when that comes to an end. And that could be coming to the center to get grab and go meals, or having a lunch at the center, or maybe it's a combination of Soups Up and Food Pantry, or maybe home delivered meals at this point. So there, we have options and resources, but I did want to say that out loud here, that if that's you and you want to start planning, call us and talk to us about that. And we will be calling all of you as well. So other than that, I think that's it, Gloria. I think we could take questions otherwise, if anybody has them.
Questions for anybody? Any questions for Aaron? Any questions for Gemma? Go ahead.
I wanted to know if we need COVID testing going forward. What is the easiest way if we have Medicare to get testing? If we
Yep. Good question. Yep. Thanks, Kathy. So we are recommending right now Metropolitan Hospital. Maybe we can try to put that in the chat as well, but or I don't know, somebody of Gemma, maybe we have try to pull it up, the thing. But Metropolitan Hospital is quick and pretty fast turnaround. They're getting PCR tests, which are the better of the two tests, back within a day. Let me see if I can find the times. They are also a good resource for vaccines. So if you have not received the vaccine and you're ready to do it, we strongly encourage you to do that. And Metropolitan is a great resource for that as well. Okay, so PCR testing for COVID is available at the Medical Screening Annex on East 97th Street, close to 2nd Avenue. So Metropolitan Hospital on East 97th and 2nd Avenue. If you, it's the NYC Health. Yep. If you walk in there, they can point you in the right direction. Monday through Saturday, 8 to 4. So Monday through Saturday, 8 to 4. That's, I think, the best resource if you live near the center for testing.
I also saw on my computer, Aaron, that CVS was giving the vaccine. And we have CVS all around us, so we might try there also.
The vaccine, yep. Yes, if you want the vaccine, that's we can set you up quickly, I think, with all these resources that are there. We're ready to go. We have a good.
Is that the booster shot, or is that the?
For the first dose for folks for so far. We are following booster shot information quickly, closely though. And as soon as we hear, we will do our best to set up resources for that as well. It sounds like that's coming for everyone. So we haven't heard yet about when and where or the recommendations. So.
Can I ask a question? Can I ask a question?
Yes, Penina.
The booster shot I saw on TV, they said that you have to take it 8 months later. Is this correct? Do you know anything about it?
So far, Penina, I've heard similar stuff. Yep. So it sounds like they haven't announced the full recommendations or how to sign up, but it sounds like that you're right. It's going to be after a certain period of time, and I heard 8 months as well. But as soon as we hear more, we'll set up some like workshops and information sessions and all that to make sure you get the right info.
Just a
Can I ask another question? Can I ask another question?
Aaron, may I ask the question, please?
Yes, I think Penina had one more thing to add, Elsie, and then you're next. Is that okay?
Yeah, when you take the flu shot, the pneumonia shot, and the booster, how many days in between you should wait, like from the flu to the pneumonia? I don't know if you know it.
That's a good question. I wish we had Lachelle on, because I know when I went for my vaccine, they asked me if I had the flu shot within a couple of weeks. So we'll make sure we get that information
Okay.
out
All right.
to you
Okay.
as well, okay?
Just
All right,
as a
thank you.
reminder, you should always consult with your doctor first.
Yes.
Okay.
That's-
Have a
Okay.
doctor consult with them because they'll know your medical history best,
Yeah,
so
that's
they'll be
true.
able to
That's
best
true.
advise you.
Yeah,
That's
but it's a good thing to bring up, Panita, especially since we're planning the flu shot clinic later in September. So
I know Elsie had a question, and then there's
Yes,
questions in the
yes.
dining room.
Yeah, Aaron and Gemma, I got already my vaccine, the 1 and 2 is Moderna. And I'm
Mhm.
looking forward to have the booster shot. My question it is to find out if I got them. I don't know. I got the Moderna and the booster shot. Can I have Pfizer, or I still have to have Moderna? People don't know about that question, so
Yeah.
maybe you know, or you
So
can find
I don't.
out.
Yeah, thank you, Elsie. I don't think we can answer specifics today about the booster shots. We just don't know enough yet, but I can commit for us to share that information, and we will be very diligent about getting that information to you as soon as it's available. We'll have lots of information sessions and materials for that. They're all important questions.
In the
Yeah,
dining room.
Yeah, we have a question here.
great. Hi, dining room. Yes, what's the question?
Yeah, so they can't hear. Weird.
Hi, guys, it's Karen Wolfrath. Good to see you.
Hi.
Once everybody, vaccinated or not, enters the building, do you need the mask to remain on at all times?
Yes, no matter whether you're vaccinated or not, you have to keep wearing your mask and do the health screening.
Okay.
Yeah.
A lot of people come in and once they're in the classes, you know, they take them down or halfway or off altogether.
So thank you for bringing that to our attention. We've been monitoring that, but we will monitor even closer and we have to make sure that we remind everybody to keep masks on. Unless you're actively eating in the dining room, you should have your mask on. That's even if you're exercising, which I know is a little uncomfortable, but it's important. We know that even if you're vaccinated, you can spread trace of COVID-19. So it's important that we keep doing that to protect each other.
Sure. Also, just a side note on information, pneumonia shots for seniors are supposed to last 10 years now. So it's not a yearly shot like a flu shot would be normally. So again, ask your own doctor and just so you don't think, if you can have 2 shots rather than 3, ask your doctor.
There you go. No, thank you for that.
Yeah,
Thank you
yeah.
for that. Yeah. Okay. Who else? Any other questions?
Sandy, something?
Hello.
Hi.
It's Sandy.
Hi, Sandy.
My question is about that depression group you were talking about. Is there an age cap for that? Because we usually get excluded because we're not old enough.
60 years old.
So
This
since
is
the
60 years
program
old.
is with Cornell, they have specific, it's part of a research study as well. So they had to have very strict guidelines for the study. I think attending will still be beneficial, even if you don't qualify specifically for their program, because they give a lot of really great information of like how to do self-screeners for depression and what kind of symptoms and signs can tell you. You can help self-identify, but not self-diagnose necessarily. And I'm sure they'll be able to share some really helpful resources that if you don't qualify at the moment, in the meantime, they'd be able to direct you.
Thank you.
Gloria, before we move on, Margie, 1 second. Gloria, can you share for the program that you're talking about and that Sandy was mentioning? And I'll also say, if anybody is experiencing symptoms of depression or know somebody that is, there are multiple resources we can connect you with. So it's not just that program, but for that program, Gloria, is that both for the trainers and the person being counseled, the age requirement, or is it just for the folks receiving the service.
That's for the participants.
I
So
think
you
it's
can be a,
adult.
so you can be a trainer of that program if you are,
But they are complete, they already hired trainer already. So right now they just recruit the participants on it.
okay,
Yeah,
okay,
okay.
thank you. Okay, Margie?
Karen, the other day I was walking out the center, and I'm finding a lot of bags with cans outside the center in the middle of the day or nighttime. I mean, you guys used to give the pantry only once a month, but you're giving it now constantly. And a lot of people are leaving bags of cans outside the center.
Bags of cans, like cans of food, leaving it outside the center?
Outside the center, in the park area. It's sad.
Cans of food outside.
Well, so I'll ask Alberto if he can update us on how Food Pantry is working. There are days for it, but there are also, you know, we have a team that's delivering those, so that sometimes is different days. But yeah, I'm sorry to hear that somebody's leaving it outside. That's a waste of food and effort. So that is we'll keep an eye out for that. But Alberto, can you speak to Food Bank and how folks can get connected with that and what days it happens?
Karen,
Hello, everyone. So yeah, food bank. So we do food bank every Wednesday from 10 to 3. So right now we're doing a delivery option, but also we do have a pickup option as well. We generally do phone calls and reach out to whoever's interested in receiving pantry for that week. For those who are interested in signing up, all you have to do is contact me. We'll go through a quick process. And we'll have you signed up, and starting from there on, we could deliver to you every week on Wednesday if that's something that you are interested in.
Hello. I would like to ask a question about that, but I have so questions to ask about the protocols about the vaccine. Alberto,
Sure.
The food pantry, when you give a call on Wednesday, I'd like to suggest that the person should let you know what they do not need that week in the bag. That would alleviate all of that cans outside the center being left by people that don't want what they have in their packet. That food could be given to somebody else.
That's true.
And also, the other day, I was going to pass 96th Street Park. One of the workers was in the park with one of those wagons, readjusting the food, taking out and in. I don't know whether he was packing, repacking, but that shouldn't be. That should be done in the center.
So I'm not quite sure what that what's that about, but I will talk to my team and try to get to the bottom of it. Thank you for that.
Thank you.
Yep. Yep. Thanks.
Okay,
Thanks
now,
for that
I would
feedback.
like to go. I would like to ask Airman and the staff.
You muted yourself.
Oh, you went on mute. You went into mute there. Lorraine.
Okay.
Yeah.
First question is, since it is, I know now through all my calls, and I'm not finished all my calls and try to find out what's going on at the center, that it's okay whether you're vaccinated or not to come in the center. But I would like to know what is being done about the people that's choosing not to participate in vaccination. How is that to assure me that that person is not going past the door without showing some kind of proof of whether they are just the temperature is not going to tell a whole story. I think that it's important that more education be done so that people that are afraid to get it may get it, because there's a lot of information and a lot of people, if they are understood the reasons other than millions of people, thousands of people dying, I don't understand why, but maybe it should be some education. I know that Aaron said there will soon be education, some things being talked about in reference to the vaccine, but some people that are ignorant to this vaccine, it's because they don't understand the importance of it, or why they should get it, or why not. Why not? There's got to be a better way for me to be safe coming in that center, not knowing that a lot of people that are on staff are not vaccinated. I don't see anybody or hear of anybody getting swabbed that are workers. What is going to be done about that? People that are workers or volunteers that refuse to get the vaccination. What is it about that? Are they showing their weekly COVID-19 there, that is a negative? I don't see it. I also don't see in the center, like when we have that open day with backpacks and 70 person there was a lot of wiping down going on. I have not seen that person wiping down or anybody else wiping down the area since. So I didn't know. I just feel that it's not safe for me to go in the center until I get some better answers on whether I'm being safe in there or not.
Okay, well, thank you for all that. And I certainly hear that loud and clear and understand. So I'll try to, sort of reiterate or reframe, just so, again, if you're a staff, volunteer, or consultant, so if you're providing a service of any kind, then the mandate that we are following very, very strictly is that you must either show proof of vaccination or submit a weekly PCR test, a negative test result. And we're monitoring that and keeping track of that for all staff, consultants, and volunteers. So that's happening. For participants that come in, we are not asking that. We can't ask that. It's not part of the mandate, but we do a screen, a health screen, and a temperature check for everybody. So it is true that there could be participants in the center that are unvaccinated. They have to wear masks and adhere to all of the rules, but that's where it is right now. So we do have cleaning protocols, and we are enforcing social distancing where possible, and doing and really trying to adhere to the masks closely. Now, we heard today that there's been times when people are pulling their masks down in classes. We will really step up to monitor that and make sure that that's not happening. And we'll do everything we can to stay safe and to keep the program safe. And I'll also say again that I understand if at this point you feel more comfortable with virtual programming or doing calls. I do understand that. We want you to be in person. We want you to participate and see each other, but this is something that everybody has to make a decision about. We just want to make sure that we are providing options and ways for everybody to engage, whether it's in person or virtually, and that people have access. I'll also say that we strongly, strongly, strongly recommend that everybody be vaccinated and get vaccinated. We have been doing trainings, information sessions. We did vaccine clinic in March and April. So we have done a lot of information sessions about the vaccine to both the participants and to staff. So if folks have decided not to do that, they're doing that with still having access to information. We'll continue to do that. And as more information comes out about the booster, we'll keep doing that too. So Lorraine, I hear everything you're saying, and I appreciate that feedback. And I'm sure that there's others that feel the same. So we will keep adjusting and providing information. And if folks want to have access to testing or to vaccines, we are very eager to help you get that.
Okay, another thing, I appreciate that you did say you strongly suggest that people get vaccinated. I appreciate you saying that. Also,
yeah,
as far as a few people on the line that were asking questions about the vaccination that you could not answer because you don't have the information before you, it's very
the booster.
Get those questions answered as quickly as possible, because I'm sure if they're asking questions, there's a lot more questions to be asked.
Yeah, I want to be clear though, the questions that we can't answer about the vaccines are related to the booster, and that's only because that information is very new and we haven't received guidance on how that's going to go about. But we are following it closely, and we'll certainly get information out as soon as we can. And if we can host a clinic again, we'll do that. If we can partner with Metropolitan or other partners of ours, we'll do that. And I mean, it's a top priority to make sure that all of you have access to healthcare and to these vaccines to protect you against this ongoing threat and this ongoing pandemic.
Yeah, Aaron, the only thing I want to add also is that the intention, in addition to sort of providing information as we receive it regarding the booster or anything else related to vaccines, I think what would be ideal also is to have a medical professional come on to answer specific questions for folks, right? Because because the staff, you know, we do have you know, support of nursing, but you know, our staff are not medical professionals, and it is certainly not the best for us to be giving out medical advice. Also, please keep in mind, right, we are following CDC guidelines, DOH guidelines, and we're trying to ensure that the information we're giving and the guidelines we're following are by the city and state standard. Obviously, a lot of these things continue to evolve, right? And we want to keep track of those things and make sure to provide those as we get information from the city and the state. But we want to thank everybody for sort of raising these concerns. We certainly have the exact same concerns and want nothing more than to ensure the health and safety of everyone who's entering the building, staff, volunteers, and participants. So Aaron and Gemma, maybe, you know, if we can send out something just for you guys to make a note to please send out something about when we can hold some type of gathering where we can have a medical professional to come on.
Thank you. Very good. Thank you.
Yeah, we're still.
Aaron?
Yes.
Hello?
Yes, Maria.
Oh, yeah, I have a question. Would you be getting in those fabric masks?
What's that?
You know the
What?
mask? The fabric kind.
I have some. Just next time you come in, ask me and I'll find some for you.
Yep, Gemma has those masks for you.
All right, thank you.
Thank you.
Just a reminder, and I can reshare it in the email when we're done with my summary. We do still have the recordings of the meetings we had with the doctors from Montefiore, and I believe New York Presbyterian is where the other doctor is from. And we're still in the process. I know with a lot of the news with the booster shots, there's a lot of questions of why do we have to get a booster? Where can I get a booster? When should I get my booster, et cetera, et cetera. So we definitely want, we're in the works and talking to people about planning meetings. So you haven't heard anything yet, but we're working on it. So as soon as I get that information, we will have the program on Zoom, hybrid, streamed in the dining room, the whole shebang. I see we also have a question in the dining room.
One more question.
Hi, it's Karen again. I was watching New York One this morning, and one of the NYCHA buildings in the Bronx that has a senior center was having horrendous conditions up there, floods and damage and whatnot. Anyway, we've been having this leak in room 6 ongoing now for a couple of weeks. Can you give us an update as to when this might be fixed?
Crystal, are you on, or Parker, do you have any updates on any status of that ticket? I know that's been an ongoing.
I don't know which ticket this is. This is room 6?
Room 6, yeah.
Can someone, Gemma or Crystal or somebody, can someone send me the ticket number and I'll follow up?
Yeah, we'll check in the status of that.
Just send me an email, please, that I can forward. Thank you.
I have another question about the upcoming bathroom renovation that was mentioned earlier in this meeting. I am concerned about if they are closing off the bathroom access. I would like to know, how would a person in a wheelchair go to the bathroom if they can't access the bathrooms in Stanley Isaacs? How can that be worked out?
Absolutely, Lorraine. Thank you for raising that. That's first and foremost on our mind. We want to make sure that our bathrooms are accessible to everybody. We do have staff bathrooms in the same building, but we're not sure, obviously, if that's going to be suitable. And so part of what is happening tomorrow is that there's going to be an on-site sort of walkthrough to talk about how best to solve some of these problems before we begin construction. Keep in mind, we also have another building, which is the youth center a couple steps away. You know, if you walk through the courtyard, it may wind up being that we direct folks to that building. But again, we haven't made any decisions about those types of details. And those are certainly great questions that we're going to try to answer before we even begin construction. Okay, so more information soon.
All right, you said that you're going to do a walkthrough tomorrow to find out where access to certain things are? Because in the 1219, is that the bill you're talking about to get to the bathroom?
So first of all, there's been no decisions made as to how we're going to sort of solve this issue.
Oh, I understand. I'm
Right,
just wanting to put it
but-
out there. So while you're
Yeah.
doing your walkthroughs and your meetings and all stuff like that, that is a great concern, that's all.
Yeah, we appreciate that. It's a great concern for us as well. And the project will certainly not move forward until we've provided answers to those questions.
All right, thank you.
No problem. Thank you.
Alrighty, any last minute questions before we wrap up? We're kind of cutting it close right now. I'm gonna.
I have more questions, but I'm not gonna take up your time. I'll see everybody that I need to see.
Vera, I
one-on-one.
saw you raising your hand. Did you have a question?
Yeah, I wanted to ask about, Aaron said something about you're gonna try to start up trips again and getting a bus driver and all of that. Are you talking about trips to like Walmart, or what kind of trips are you talking about?
Yeah, trips in general. So there are the group, the East Harlem group at Taft. They took a trip up to Woodbury Commons recently. So that program that we used to use at Amazing Destinations is back up and running. They have good protocols in place and for safety on those, and did a trip up there. So we can try to look at those again for the fall. And then once we have, a driver, we'll get a schedule going again for trips to Stu Leonard's and to Aldi's and all the places we used to like to go for shopping. Obviously, those will be limited capacity, but we'll try to do enough of them that, everyone that wants to can participate.
Thank you.
Yeah.
Does anyone else have any questions in the dining room? We got to move out of that room so there's space for the pool. Last call for dining room questions, last call.
But what about other people that have questions that's not in the dining room?
Well, they have to leave the dining room, period. We got to end this meeting.
And so if I'm not in the dining room, I can't ask any more questions.
No,
I'm not in the dining room.
you can ask questions, but that's.
All right. What's the question, Lorraine?
No, I don't want to be rushed. I'll see. I'll make my calls accordingly. I'm not going to be rushing in my questions because I really need to have answers to specific questions. I appreciate all the answers that you gave me so far, but I'm not going to be rushed. It's very
Sure. No, we're available. We're happy to answer questions. Yeah.
Gemma has a thing that we must move on, and so I'm going to honor that.
Okay. Well, we can follow up as well.
Thank you.
TV out of the dining room. That's what I was trying to refer to. We need to move the TV out of the dining room. That's why.
Okay.
Question there.
Okay. Any last thoughts or questions before we go? Thank you. This is a very productive meeting. It's good to see everyone again. Welcome back to membership meeting, back to the center. And if there are questions that didn't get answered and you want follow up, feel free to reach out to any of us. We'll answer them. Gloria, anything else you want to send us out?
Well, I was thinking of something, but right about now. Oh my goodness. Okay. This is no other way. This is no other way. Could we but see the pattern of our days, we should discern how devious were the ways by which we came to this, the present time, this place in life, and we should see the climb our souls have made up through the years. We should forget the hurts, the wanderings, the fears, the wastelands of our life, and know that we could come no other way or grow into our good without these steps our feet found hard to take, our faith found hard to meet. The road of life winds on, and we like travelers go from turn to turn until we come to know the truth that life is endless and that we forever are inhabitants of all eternity. So let's just kind of focus on that, what the year has been like, how far all of us have come through faith and love and understanding and peace for each other. And let's just continue on that path because we do have a long way to go. So thank you all for coming out this afternoon. I think it's been a very informative meeting for all of us, and just take it all in stride. And we see you all
Thank
next.
you very much.
Okay.
Thank you.
Thank you,
Thank
Gloria.
you.
Thank you very much.
Thank
Bye.
you. Thank
Bye,
you,
Good to see you,
everybody.
Gloria.
Thank you,
Thank you.
Gloria.
Thank you, everyone.
Thank you.
Thank you, Aaron.
Take care, everyone.
Take care. Thank you very much.
Aaron and Gemma, there are no words, but you guys know how I feel about you. Every day, every day, every day, every day.
Yeah, they're doing a great job.
They certainly are.
Yeah, yes.
They certainly are.
Yeah, God bless you all.
Yeah.
Yeah.
Thank you.
God bless you all.
God bless you.
Thank you everyone for joining. I'm gonna jump off because we gotta end this meeting. So if you want to join for happy hour, that's at 3:30.